very much to SALT for organizing this opportunity for us to talk a little bit more with all of you about the positions we have relating to the provision of seniors care in Alberta, not only as individual candidates, but also all three of us as representatives of Alberta's NDP. And so it's really a pleasure for me to be here with all of you and to be sharing this front with David and Rod. And I'm very excited to be able to speak in more detail about seniors issues today. We've had a couple of debates already, but I was surprised to discover how little time we had in answer to each question to really sort of dig a little deeper and talk a little bit more substantively about seniors issues. And so I'm pleased to be able to have a chance to talk in a little bit more detail today, especially because I think that the issues we'll talk about today are extremely important. They have massive implications for the overarching quality of our healthcare system and for the overall health of our communities. And so what we talk about today really is very fundamental to our path forward as a province. Now, one of the reasons that I've chosen to run in this leadership race is because I believe we're on the verge of a very historic time in Alberta. I believe that the values of many, many Albertans have moved well beyond the values that are articulated by the two conservative parties on the right, that being the Wildrose and the Conservatives. I think that we need change in this province. I think we need real change in this province. And I don't believe that a new Conservative leader represents that real change, nor does a Wildrose government that's following the same rigid ideology represent that change that we need. I do believe that Albertans are looking for something different. I think they tried to actually vote for it in the last election. Perhaps it was a bit misguided, but without question, that's what many people were trying to do. And they didn't get what they tried to vote for in the last election. So I think that we have an unprecedented opportunity. I think the right is divided, and Albertans are looking for progressive government. And I'm hoping to be able to use my leadership skills, my experience, and my record of success to build a modern, progressive movement in Alberta that is truly capable of taking on the Conservatives and the Wildrose and winning. Because I want to form a practical, hard-working government that's guided by strong, progressive values and committed to serving the best interests of our citizens. I want to take sound action to ensure that we have accessible and affordable seniors care that effectively delivers and protects the health of our seniors and the quality of life enjoyed by seniors. And I want to make sure that the process through which we do that fundamentally recognizes one of our most important values, which is fairness, so that that process is publicly funded and publicly delivered and fairly received amongst all seniors in Alberta, regardless of income. That, to me, is a fundamental component of any Alberta that we build going forward. And that, to me, is something that I know the Alberta NDP can deliver, and something that I hope to be able to lead the NDP in delivering. So thank you very much for being here today, and I look forward to our discussion.
Well, thank you for coming this afternoon, and thank you very much to SALT for hosting this event. I remember speaking to the group in a smaller venue over here at least a couple of times in the past, and certainly I know many of you, we've worked together for many years on different health issues, and particularly on seniors as well. And so I'm a bit intimidated, I must say, because I know there's quite a number of you that know an awful lot about healthcare generally and seniors care specifically. So I'm not afraid to be corrected. I would like to acknowledge as well that we are on Treaty 6 land here, and it's important to Rod's help to help us to remember that in every place we've been around the province so far, and it's important to acknowledge our place and time and our responsibilities in general. I'm very happy to be sharing the stage with both Rachel and Rod. They are remarkable speakers and have very sharp minds and sharp wits as well. And hopefully we can have not just a sharing of information here, but an entertaining afternoon as well. As Rachel pointed out very succinctly, that we are in the midst of a very unprecedented opportunity to really move politics here in the province of Alberta, not to just a defensive position that we're so used to doing. We're trying to defend Medicare or save some scraps of the public interest, but rather to start pushing that pendulum back to fighting for things that we really want, to have something that we can look forward to and provide a sense of hope as well, I think, in politics here in the province of Alberta. We know that the vast majority of Albertans share the values that we represent as the Alberta New Democrats, the sense of equality, sense of social justice, and sustainability. And I think for far too long, we've been looking down in our holes and hoping for the best and expecting the worst in the political landscape here, when, in fact, now's the time that we can pop up and actually start to move forward to make a more equal and just society for everyone. And I think that in no place more obviously, I think, is in terms of seniors policy and seniors health policy that we can start to push back after many, many years of privatization and diminishing returns and really sentencing so many of our citizens here, so many of our seniors in Alberta, to poverty and uncertainty and a lack of security for the future. So I'm excited, but I also feel the weight of responsibility here too, to make sure that we get this right, to make sure that we have a united progressive movement that includes everyone that shares our ideals. And lo and behold, the majority of Albertans actually do share those ideals. And so it's a question of articulation, it's a question of us doing our job as leaders, but for each individual to do those jobs as well. And as John very subtly pointed out, that we can have this process starting by making sure that people buy a membership to participate in this leadership race. Whoever you decide is the best up here, sharpest dresser, or the best speaker, or however you decide for your leaders, make sure that you don't leave without buying a membership and actually participate in this race on the 18th of October. It's absolutely essential. We're seeing growth in regards to interest, in regards to money coming on our way to the NDP, in regards to individuals that are signing up to be participating, but also candidates as well. So it's an optimistic time, and I think that's when we really can capitalize and build something that we can all be proud of in the future. Thank you very much.
Good afternoon, or yes, good afternoon. Good afternoon, ladies and gentlemen. I really appreciate the opportunity to be here because out of the three candidates, I'm most likely the most not well known. Simply because I don't have the track record of being a member of the Legislative Assembly. But I can tell you that I've been working just as hard outside of that Legislative Assembly on the front line of many struggles across Alberta, lending my support to people such as yourselves fighting for one thing, and that's dignity. Ladies and gentlemen, the struggle that we have before us is exactly that, our own dignity. And that's what the Alberta NDP, when you basically summarize it into what we represent and what we are trying to achieve, is a government that respects humanity and the dignity of each and every person living in this province, making sure that they have the public services that they need so that they can live comfortably with their families, being able to contribute to our society, making it better each and every day. That's what this struggle is about, and that's what I've been dedicating my life to since I came out of the womb, I'll be honest with you. I'm originally from Chile. My mother and father brought us to Canada as a result of the military coup that occurred in 1973. The anniversary upon is right around the corner. Ladies and gentlemen, what happened in that military coup is that people were denied their right to dignity. So growing up here in Canada, I was consistently and ever more participating in movements for solidarity and standing up for the human rights of all individuals, no matter where they lived on this planet, because it was taught to me and ingrained to me that that was the fundamental value as we move forward as humanity. So ladies and gentlemen, that is the struggle that we invite all of you to participate in. Really, it goes beyond party lines, this struggle for dignity. Everyone should be struggling for it. So then I ask you, why is the Alberta NDP the only one putting it forward in their platform? And that's what we want you to stop and consider, that we're the party that's fighting for that. Growing up here in Alberta, I never suspected that I would be in front of you here today. You know, I just didn't see it as something achievable. But let me tell you, the support that I've had from members within the Alberta NDP, they gave me the opportunity to be able to be here before you and express my concerns and my ideas. And that's why the Alberta NDP is the party for me, for Rachel, for David, for you. I believe that as we move forward, there's three fundamental things, no matter what the issue. And that is, we need to make sure that we are fixing the revenue problem that this province has by having progressive taxation and changing the royalty regime that we have. That is absolutely essential. Number two, training. Post-secondary education is the answer to all of our problems. Because at the end of the day, it's the services and products that people need that are going to be able to have them live with comfort and dignity here in this province. By training people, no matter if it's college, university, or what the case, that's the way we're going to be investing in our future. And then number three, on the front line of every workplace, we need to make sure that support staff, administrators, whether it's in the public school system, the school boards, that we get people working together to understand where the gaps in the system are and the solutions to overcome them. We're only going to be able to do that in a collaborative and a cooperative way. That's what the NDP can bring to the province of Alberta, and I know we can get there. Let's get the job done.
Okay, everybody else is on schedule but me. All right, question one. And speaker number one, Rachel, in your opinion, what principles should guide development of policies and programs for CDS?
All right, can I get 5 minutes, you said?
Only 5 minutes.
5 minutes, okay, cool. I'm not actually reading my email here, just to be clear. What I'm doing is, I just put a stopwatch on, so that's what that's about. So, I just jotted a few notes to myself, in terms of trying to delineate the principles, because there's so many pieces of elder care in Alberta that I think warrant discussion, and hopefully I don't miss out on anything with what I just quickly jotted down, 5 principles that ought to guide where we go. The first, and I think overarching because it secures the success of the other 4 principles, is of course the issue of ensuring that our care is both publicly funded and publicly delivered. There is not room for people to be making a profit off of the need to care for a certain section of our population. And whenever we build in that opportunity for profit, we invariably end up compromising the quality of care and the quality of life of the people who rely on that care. And so we need to do everything that we can to ensure that our seniors' care is in fact publicly funded and publicly delivered. So closely connected to that, of course, is the issue of equality. And with that I mean that the level of care that people receive shouldn't be dependent on how much money they have. It also shouldn't be dependent on where they live. It shouldn't be dependent on how many children they have to care for them, or how far they live from their children, or their sisters and their brothers, or their aunts, or their uncles. It should be the case that people can live with security and dignity as they age, regardless of those kinds of factors. And that we are there as a community to ensure that that level of care is provided fairly and equally to all seniors who require it. The third thing that I want to talk about is the issue of the principle, I suppose, of comprehensiveness, for lack of a better word. And by that I mean that we ensure that all the care needs are properly addressed, so that we don't say, oh yes, we'll cover this thing here because that's healthcare, but we won't cover that other thing there because it's not. And we'll provide this quality of life thing here because, you know, it happens to be convenient, but we won't cover this quality of life thing over there. So we need to ensure that not only acute medical services, but preventative medical assistance and quality of life and recreational issues, all of those issues are addressed comprehensively. And of course, pharmaceuticals, that's part of it as well. And we have a tremendous amount of inconsistency with respect to how we provide pharmaceutical care to seniors, even with the current situation, because even now the costs that people are asked to co-pay may well, in fact, prohibit some people from getting fully covered care, or conversely, we don't cover everything that they should be getting. The other thing, I see I've got 3.5 minutes left, is the issue of the principle of accountability. So as we provide for publicly funded and publicly delivered care, we need to build in accountability to ensure that where the system starts to go off the rails, there's a transparent and open place where it can be, venue in which it can be corrected. So with that, I'm looking at the issues of the seniors advocate and as well greater transparency in terms of the way care is provided. As we know, there's been a lot of problems with that in Alberta, with, you know, homes banning family members and people not being able to get access to information and all that kind of stuff. The final thing that I'll talk about, which is not so much medical, but it's global and I think it's ultimately very fundamental, is the issue of security. And so that comes down to issues of not only health care and quality of life, but also, you know, housing and income. We need to ensure that when people are aged, that they do it in a way that where they can be secure, they can live an appropriate quality of life. And that's something that we have to turn our mind to. Not only you folks as seniors, most of you now, but also us who are almost seniors and those who won't be seniors for another 30 years. And that's related to the issue of making sure that we provide for an affordable or retirement security, income security for people in Canada when they retire. We have a looming problem that all right-wing governments are doing everything they can to ignore. But it's not only going to hurt the seniors of the future, it's going to hurt the whole community. Right. And so that's, I think, my 5 priorities. Thank you so much, Noel.
Well, thank you, Rachel. And it's interesting because, of course, in the Westminster system of parliaments, you have a House Leader and then you have a whip as well. And so I'm the whip of the Alberta Democrats. And I've never had to crack that whip because we deal from a deck of cards which include fundamental principles that we do not waver from. And so I'm just saying this because Rachel pretty much said the things that I was going to say. And, you know, when we are dealing with issues around healthcare and seniors care, it becomes patently obvious when we face legislation and issues that come forward to us inside and outside of the legislature as well. And it's interesting that we have a document that includes all of Canada, and not just the province of Alberta, with Canada Health Act. And the Canada Health Act is fundamentally built on the principles of equality. And you cannot discriminate because of geographic location or financial situation, age, health status, and many other issues around that. That's the guiding principle that we employ every time we deal with a health issue that comes forward or the responsibilities therein from the provincial legislature. And so once you start to apply that principle in a fundamental way, not just as a legal document, as many governments have tried to do, they try to split hairs and look at it like something, a legal document that they can weasel out of somehow, but a deeply held moral principle that underlies the Canada Health Act, then that fundamental idea of equality really starts to bear fruit, not just for ethical standard, but for actual programs that we know need to be there to look after people in all stages of their life. And so it's very important. The second principle that I've come to learn most fundamentally, and I don't have to tell you, is that the necessity of publicly delivered, not just publicly funded, healthcare throughout the system, regardless if it's for seniors or for children and everybody in between. We don't have to look any further than to see anything that lies outside of the publicly funded, publicly delivered realm of healthcare to see what chaos and confusion and inefficiencies preside in those areas, in dentistry, in pharmacy, in occupational therapy, and so forth. So many areas that just have been either pushed out of the public delivery of healthcare or are on their way being pushed out. And again, seniors care over this last decade since I've taken it on as a passion and something I pursued inside and outside of the legislature. Again, the privatization of seniors care and seniors housing, it has been the single most difficult circumstance that we've had to deal with, both inside and outside the legislature. So these are the issues that we deal with, the principles that we deal with, the idea of public delivered healthcare, the idea of equality, again, justice, back to those other guiding principles as the Democrats. There's certain individual issues that I think that we can bring forward now that would help to buttress our pursuit of those principles. I would suggest, as leader, and then of course as the Premier of Alberta, that we should have a seniors ministry as part of the cabinet of the Alberta legislature. A seniors ministry at this time would be timely and very, very appropriate. And again, as an office of the legislature, to have a seniors advocate as an officer of the legislature as well. We've seen some fruit being born from the children's advocate. There's a long ways to go, and certainly we could see obvious benefits of creating an office of the legislature to deal specifically for seniors advocacy. And so those are the guiding principles. Some of them are positive and some of them are negative. We know that the basic fight that we've always ended up with, like it happens every day, it happens today. The Auditor General's report just came out here now, talking about chronic care management and the basic flaws or gaps in chronic care management. Again, it's the underlying idea of are we treating everyone equal? And to what degree has chronic care and the management of chronic disease care has been privatized? Those are the places where we start to push back. Like I said from the beginning, start to create something that we all can be more proud of. Thank you.
Where do I go from here? Well, I would definitely echo everything that's been shared by David and Rachel so far, especially in terms of publicly funded and publicly delivered, and as well as comprehensive care, making sure that any kind of elder care program moving into the future is community-based. Now, a fundamental principle of being a community-based program would mean that you yourself would have input and you would be empowered to discern what your own program would look like. People in the system should be able to contribute to what that system would look like as they benefit from it. And that's something that's absolutely essential, because it goes into the whole principle of being collaborative and cooperative and working with the community in order to establish program. We can see that, for example, elder care right now is being provided by many not-for-profit organizations or facilities or societies. And I just want to share with you something that's really important, that even though these organizations are not-for-profit, the administration of these not-for-profit organizations are starting to act like for-profit facilities, which is a major concern of mine, and I'm sure of my colleagues here and yourself as we move forward, especially when it comes to the issue of support staff workers in those centers. You may have heard that this week Shepherd's Care has decided to lay off 157 workers that provide maintenance services, washing, bedding, food service, all these kinds of things. And that we actually know that Alberta Health Services is suggesting that they hire temporary foreign workers in order to do the work instead of union staff. So this is something of a major concern. When we talk about the dignity of everybody in the system, we're talking about those who receive the care, but also those who provide the care as well. It's very important. Another part of the principles moving forward, I would say, is not just equality, but also equity. As David mentioned in the beginning, I'm a major advocate of the inherent and treaty rights of Indigenous people. And part of the equation that we need to do moving forward is to take into consideration the ills that colonialism has created in presenting barriers in our system. Now, you think about yourselves as seniors. Now think about what seniors in Indigenous communities have to face day in, day out, which might even be similar to those who are in rural communities. So there's a number of things that we have to address. So equity is absolutely important as well, as I'm sure my colleagues would agree, is that the system is going to have to provide services to people in relation to their need, especially. As well as that, I think that an Alberta NDP government under my leadership would make sure to expand the public health care to include continuing care services. It would improve the quality of care by having appropriate staffing. And number one, we would phase out for-profit elder care. As Rachel signified or contributed, we're looking at the decrease in the quality of elder care moving forward.
1 minute.
And then again, the principle of transparency, making sure that the information about elder care facilities is easily accessible by all those in the community so that we can analyze and assess it appropriately, making sure that we're identifying the gaps and searching for those solutions as I suggested in my introduction. Thank you very much.
I'd like to thank our speakers for addressing the first question. Do we have a... No, all right, this is the water boy. Let's move on to the next of our little questions, big questions. Carol, could you... All right, thank you. What are the most egregious features of the current system and how would you change them? Rachel.
Well, thank you. It's a pleasure to kick off this thing as well, this part of it. I think that, certainly as an MLA for many years, I was elected in 2008, I've had a lot of people come to me and talk about, with great feeling and in some cases, great angst about the experience that either they are having or their loved ones are having within the system. And so it's, to me, it is distressing that it is often so difficult to find a quick answer for those very real anxieties and crises that people sometimes are forced to deal with. I think that in general, they come from and so for instance, it can vary. It can be someone who's coming to talk to me about the fact that their loved one is in a long-term care center and they are fully believe that they're not getting the care that they need, they're not getting the food that they need when they need it, they're not getting the medical care they need, all that kind of stuff. Or it can be someone coming to me saying, you know, my mom or my dad's still living at home and they won't leave their home. And I want them to be able to stay at home, but I can't get them the help that they need for all of us to know that they're secure in their home. And so now I'm going to their home, you know, 4 or 5 hours a day, in addition to, you know, working full time and dealing with my kids, and that kind of thing. And so how do we get things to the point where that whole family can be secure with that loved one staying at home and living at home? So ultimately, there's a broad range of services that we are not providing to seniors in Alberta right now. And it comes from 3 fundamental positions. First of all, this government is always looking for ways to privatize our healthcare system, always. There's a lot of money, there's about, I think right about $16 billion a year goes into healthcare alone. And the government's always finding a way to make sure that that money goes to their friends who are making profits off of it. And every time they do that, the level of care is reduced, whether we're talking about the home care reorganization that we all had to suffer through last summer, or whether we're talking about the way we're focusing our long-term care into something called continuing care. And really, what I think that is publicly funded real estate development. That's what it's turning into right now. So we have a continuing care system that doesn't actually adhere to standards, unless you consider the profit margin as a standard that we as government are measuring our performance by, because that really seems to be the only thing that we're winning on right now. So this constant attempt to privatize, and then the second issue is this constant attempt, and John identified it in his opening comments when he talked about the Maclean's article. It is true, the government sees many seniors now as a source of free money, and they're trying to find a way to get at that money. And so there's this constant attempt to reach into seniors' dollars, to privatize things, not just so that people can make money, but also so that seniors pay more out of pocket. And so we've got this constant attempt, for instance, to restructure pharmacare, seniors' pharmacare in Alberta, which is entirely about trying to get money from seniors. And it creates instability. And rather than limiting seniors' pharmacare, we should be expanding pharmacare to all Albertans, because that's going to actually build and grow the effectiveness of our healthcare system for everyone. And ultimately, more of our healthcare system will be there for seniors when they need it, if we're able to provide a comprehensive pharmacare system to everyone who needs pharmacare. So it's hard to sort of drill down to all the many, many complaints. I guess the other issue I'd be very concerned about right now is, again, the failure of this government to provide minimum staffing levels in our long-term care settings, whether it's officially a long-term care, or whether it's assisted living, or whether it's some other version of continuing care. It's always the case that staff are being asked to do far more than they possibly can. And that results in tremendous deterioration in the quality of life and the health of the people for whom they care. And quite frankly, it makes the people who do that work extremely anxious and stressed out themselves, because they know they're not able to deliver the care that they should be delivering. And I've worked in healthcare off and on now for 10 years prior to when I was elected. And I know what it looks like when people can't give the people for whom they care the meals that they need within an hour of when they need to have that meal, or they can't get them to the bathroom, or all those other things. So it's big picture, big issue, and I look forward to more discussion.
Well, thanks, Rachel. And certainly, I try to approach this question not just complaining, but looking for some solutions to issues that we've all dealt with over this past decade or so. And I find it interesting that we had the Auditor General's report just come out on chronic disease management. And I confess that I will have to speak on this in about 40 minutes or so to the Journal and the Herald. So I want to practice with you a little and see if my ideas seem coherent or not. But the Auditor General, he's an interesting individual because we find him to be a bit more reticent than the last one, Fred Dunn. But he's starting to show some acts of bravery, I would suggest. And he did it again today, in his own quiet way. And he said that urgent action must take place immediately. And so in those words and in his suggestions, not just for the next 6 months, but for the next 5 years or so, it identifies some fundamental problems, but ways by which we can solve those problems in our healthcare system generally and seniors care specifically, because of course chronic disease management is more prevalent as we get older. And what the Auditor General discovered, and it's what we've been saying for so many years, is that we have a lack of transparency, we have a lack of investment in collaboration, and we have a lack of data to follow up to see if the money and the efforts we're putting in are actually bearing fruit. And so, chronic disease management, of course, people get sick at different times in their lives, but we know that not handling this file properly means that the overall public health system is cast into disarray, that we have inordinately large or frequent use of the emergency rooms, of different acute care beds, that people don't have a family doctor or a healthcare professional that they can interact with properly, and the lack of chronic disease management ends up as a compounding equation, so that if someone starts with diabetes and then they deal with the heart disease and so on and so forth. So it's a great case in point to see just what chaos that this PC government has created by neglecting public health care and publicly delivered health care, but it also points to a way forward by which we can have teams of healthcare professionals working together with a doctor and nurse practitioner and other healthcare professionals to manage an individual's care and to follow through with that care through a public system in the management of a chronic condition. So often we've heard this so much, we hear it from the right-wing groups as well, the Wild Rose and the PCs, but they never do anything about it. Because if you're just dealing in a reactive way to to an acute care issue, but it has its root in chronic care, then they don't want to hear about that other part, because it involves more money, it involves more other choices that they just don't want to move to. So by building a team approach by which we follow people through with clinics and family doctors and teams of professionals, we can have a much better way to start dealing with the chronic disease management and start to monitor the success or not that we might be having with dealing with that as well. Obviously, creeping privatization is the overarching problem that is the most egregious that we have to deal with, and we see it in the long-term care situation. It's a great case in point, where by handing over more contracts to so-called not-for-profits, who often behave as large corporations, or actually the for-profit people, we notice that they like to cherry pick and look after the people that are easiest to look after. And the easiest ones that they like to look after the most are the ones with the most money, right? Those are the ones, the first assessment they do when you go to many of these places. They take a quick, a thorough examination of your bank book, maybe less about your actual physical or mental needs. And so, now we have long-term care shortage, long-term care bed shortage, at least 2,000 we could use if we had them tomorrow, and the whole system has been thrown out of whack as a result. So there's lots of places where we could go. Another one is occupational therapy and physiotherapy, right? They take those away, people are compromised as a result. If a doctor prescribes something for you, for your health care, then we should be delivering that publicly and paying for it collectively through our public healthcare system.
Right.
Thanks, David, and thank you, Rachel. I would complement that by stressing again that that the switch from long-term care to assisted living is a major concern as we move forward, as well as the expansion of for-profit delivery of residential elder care. It's important to recognize that there's a gap between the current care being delivered and provided and the care that was required to ensure residents are living with dignity and comfort. That's absolutely essential from that starting point. And we have to recognize that the reason for that is because the person receiving the care is basically seen as a consumer of the service. And that's a financial view. It's not one based on the true need of the individual receiving the care. So what's happening is that the whole system is just upside down. It's based on a financial view rather than on that of the individual. So just to give you an insight here in terms of for-profit care and some of the numbers, you have from between 1999 to 2009, you have private long-term care facilities that have a rate of return of 2.1%. Private assisted living facilities have a return of 9.14%. And just to put that into context, the US stock market over the same period of time did 1.23%. So ladies and gentlemen, the people who are taking care of elder care in this province, they see it as a cash cow. It goes back to the statement that I made before. They're seeing it from a financial perspective. Like, this is how upside down the whole system is right now. And as we stated before, the Alberta NDP would make sure that we phase out for-profit elder care. That's the number one thing that we're going to stand up for as we move forward. David started getting a little bit, well, and Rachel as well got into a little bit about pharmacare. And an Alberta NDP government under my leadership would establish a pharmacare program through general government revenue generated through progressive taxation and an increased royalty regime, as I stated at the beginning. And this would be complemented with moderate co-payments for those who could afford it. And I stress who can afford it, because as some of you may know, I'm the president of the Non-Academic Staff Association at the University of Alberta. I receive very good benefits. One day, I was going to get drugs after visiting the doctor, and I saw a young woman with her 2 children having to pay for the drugs that she needed for her child. And I thought to myself, this is crazy. I'm an individual who's, I'm not wealthy, but I have enough, I have benefits. I don't have to pay 1 red cent in order to get my drugs. Yet here's this young woman who I don't know in what profession she works, what she does, but she has children. And there she is having to pay for the drugs that she needs to make sure that her children can become well. So it shows that it's upside down. It's really important to state that the co-payments would be made by those individuals who could afford it. We need to make access to medicines more equitable in Alberta so that we may improve health outcomes, but also generate savings for Albertans. And we stress this because if the government were the major buyer of prescription drugs, it would have influence over the prices, reducing the cost of pharmaceuticals. And it would be more economical and efficient to operate our own single-payer pharmacare program as part of an inclusive healthcare system.
We're sticking quite nicely to our planned schedule. I'd like to ask the speakers first and then the audience at large if you'd like to take a 5-minute break or just carry straight on.
Yeah, that's, we'll have you.
Okay, we'll plug on. All right, so the floor is open to questions. I'd like to emphasize that we're talking about seniors issues, and the questioner, if you want to address your question to a specific speaker, do so, but you have 90 seconds. Noel, are you ready?
Yes.
Mr. Loyola, I'd just like to ask you, on this matter of the co-payment,
doesn't it make more sense for the government to actually collect through a progressive tax system the necessary revenue? It would be more efficient administratively not to have all the paperwork assessed in assessing people's income and sending bills and all those other things.
Thank you for the question. I would say that we have to acknowledge the fact that although not all seniors are wealthy or all people are wealthy in the province, for me it's very important that people who can afford to help sustain the system can provide that basically. Because as I was saying, that a fundamental principle, yes, is equality, but equity as well. And that plays into that whole concept of, well, there's some individuals that can afford it, and where some can't. So the revenue coming in from progressive taxation and the increased royalty regime would fundamentally, well, I mean, I'm open to suggestions as well. Right?
Suggestion.
Yeah, but it's a good one. I mean, moving forward though, I think that we need to consider, we need to go through a type of transition if we're going to reach our ideal in terms of the programming we want, and perhaps co-payment would get us there.
So how does it work now?
Any comment from David or Rachel?
You can go first.
Okay. Thanks. Where's next thing? Anyway, well, I was just gonna say that it's the first time I haven't actually entirely agreed with everyone up here said. but I would say that, you know, people sometimes will say to us, with the best of intentions, like truly the best of intentions, they'll say, oh, you know, if our healthcare system is in such great or such horrible shape, why don't we go back to healthcare premiums? You know, because I'm willing to pay, because we should pay our fair share too, and blah, blah, blah. I really appreciate that tremendous team spirit that is reflected in those statements. But in my view, that's not the way to go. The way to go is that you have a proper progressive tax system. And that way, the people who afford to pay more, and those who can't afford to pay more, don't pay more. The problem with suggesting even a co-payment is that what happens is even though it's income-based, it's not just income-based, it's also health-based. So then what's happening is that ill people are paying more than people who are not ill. And I don't want to see a health-based payment scheme either. I'd rather just see a clear, pure income-based. And that's why I would collect it solely through progressive income tax and reduce the co-payment dynamic and ultimately eliminate it. I don't believe people need to pay stuff to be generous or to be grateful for their healthcare system. And I don't believe the conservative ideology that if you're not paying something, you're out there irresponsibly making yourself ill. I think those are silly statements.
Yeah, well, certainly I think that when you're bringing in policy, you need to have your starting point and then your ending point as well. And so if you refer to the David and Seniors Policy sheet that you all forgot, I did put that at recapping co-payments for seniors at $25 a month, but to look for a way by which you could reduce that to zero. And so it's like a spoonful of sugar before it helps the medicine go down. People, if you change immediately to zero, you know, it just is something that invites you know, unnecessary questioning of our capacity to do things. And so as a phased reduction, I think that that's fine. That being said, that I remember like when Noel and I went to the first round of the attack of the seniors pharmaceutical strategy, and I think they invited us by mistake, for sure. No, we were not meant to be there. And when they were trying to build this extra layer of Byzantine sort of payment based on your income, and you know, we gamely put up our hands and said, well, how are you going to do that? I mean, how are you going to watch to see how much a person's income has? Does the pharmacist take care of that? I mean, the whole thing was absurd. And so hopefully we put that to bed now for the second time, the third time. And I think phasing out co-payments over time is a reasonable way to move forward. Thanks.
unfortunately, we have been told for how many generations that taxes are bad, taxes are wrong, taxes should be done away with. So how are we going to explain to John Q. Public that the reason that we're changing the tax system to make it more progressive is in order to pay for our health care, to pay for our streets, our roads, those things which we have in common. I lived in Saskatchewan back in the days when the CCF was government, and they labeled one of their taxes the education tax, so that everybody who paid it knew that that money was going into the fund that was going to fund the improvement of education in the province. And we did it. I mean, people grumbled a bit, but they got used to paying it, and they knew what it was being used for.
Was that question addressed to anyone in particular?
No, just.
All right, all three of you get to take a at it.
Yes, no, I think that we've had 40 years or more of propaganda telling us that taxes are bad. And so again, you have to sort of wean people back, pulling back. We can see that we're starting to turn the corner amongst reasonable people on the issue, but certainly there are practical ways by which we can demonstrate how fair taxation actually pays benefits and helps us to balance the budget and to save for the future too. And so we can make demonstrable changes that would not affect the vast majority of Albertans' personal income tax, starting by moving back to a progressive taxation system that looks at the very highest income and has a reasonable increase, incremental increase for individuals, I think, over $150,000 a year. The corporate tax, again, we're not collecting a North American standard for corporate tax. You don't have to look any further than Burger King, Inc., coming to Canada, not just to sell us more burgers, but to have a tax holiday by reestablishing themselves in Ontario. I mean, that's so, if that is not a wake-up call to how our income tax is out of sync with the rest of the United States, I mean, I don't know what else is. And so by having a modest corporate tax increase, we would bring in billions of dollars that would help to balance the budget and save for the future.
Yeah, I would state it's not going to be easy. We're talking about a paradigm shift, getting people to think culturally in a distinct way. It's going to take time. It's going to take an amazing amount of effort on behalf of not just ourselves as the NDP, leaders of the NDP, but the public as well. And I think that that's what we need to go back to, is discussing what it is that we hold in common. That hasn't been part of the narrative for a very long time, because so much of the public discourse out there is so focused on me, the individual. So as we move forward, it's absolutely essential for us to start talking about the common good, the commonwealth that we have, and being able to talk to people about the benefits of being able to share things collectively, own them collectively, and that's going to get us into a new world, a new way of looking things, and eventually an Alberta NDP government.
Yeah, I mean, I think most of the comments have been already made. I would just say, I think, you know, in my introductory comments, I said, I think that Albertans' values are moving beyond those of the old Conservative parties. And when I say that, I mean that because more and more public opinion research is showing that when you ask Albertans the question, I'm willing to pay my fair share, if that means that I can count on my health care when I need it, or I'm willing to pay my fair share, if that means that the kids in my community get the kind of education that will give them a bright future. I mean, you know, it's the joy of crafting public opinion questions. But the point is, when you do that, it's remarkable how many Albertans agree with that. It's actually more Albertans sometimes agree with that than people in other provinces. And meanwhile, and the conversation's happening out there, the Conservatives actually tried, under Alison Redford in a strange way, to begin a conversation about a sales tax. And I've heard the Liberals and the Conservatives talk about a sales tax in Alberta because they believe Albertans would even buy into that at this point. But again, my position on the sales tax is much the same as my position on co-payment and healthcare premiums. Don't talk to me about a flat tax until we fix our progressive tax system. So I think, and when you talk to people about that, they listen and they get a bit of a head nod. So I think part of that education is already happening. It's not quite as bad as it once was, but everybody here, Lil and everyone else is right that we have to talk amongst each other about why it's important.
Thank you, John. I would like to thank Saul for hosting this forum, and thank you for the three of you for having the courage to stand for the leadership of the NDP. You certainly, all three of you, have hit many of the major points that cause me heartburn and concern in this province and as well within this country. And I have one question I'm going to ask, and I have a comment before that. The federal Conservatives and the provincial progressive Conservatives are on the same wavelength on most issues. The feds have given up on the Canada Health Act, modernizing Medicare. The feds throw a bucket full of money to the provinces, and they don't care how the provinces spend it. There's no leadership. There is no direction. Here's money for help. Do whatever you want. And the provinces, well, geez, we got this money, and we'll see how much of this money we can set aside and provide a minimum amount of health care for our Albertans. Well, that is a problem, and something that we all should be paying great attention to because it's a common theme, both federally and provincially. One question that Rachel brought up, or one point that Rachel brought up was on security, and that security is income security. And for my organization, that is probably number 3 for seniors. How do we maintain income security of seniors? Because of the way the programs that are set up, the RIF program, you're losing money, and eventually you're going to lose it all because of the increased taxes. Everything else is costing seniors more and more. The inflation rate is affecting us more than anybody else because we don't have any new income coming in. So how do we protect our income security? Thank you.
Anybody? All three of you. Well, it was quite a cathartic experience for me to participate in the pension hearings that took place across the province after both Bill 9 and Bill 10 were taken off of the legislative table in the spring session of this year's legislature. And I must say, it was thanks to thousands of people like you who wrote into their MLAs and scared the living pants off them to say, if you touch my pension, you're gone. And then you're probably gone anyway, but that's okay. Just a notion of altering people's pensions, and it wasn't just public service pensions, it was an attack on all pensions, really brought into focus for me just how there is a unifying force there that we can work with for all Albertans. They're all concerned, and it's not just fear for your own self and your loved ones, but it's a general fear of an attack on the security of people's future, very modest incomes from their pensions. The average public service pension is about $15,000 a year being drawn out. I mean, very, very modest indeed. And so I think that's part of the responsibility we have as governments in the provincial legislature. It's not just to provide that money, but to provide the security to know that we'll make adjustments so that money and that pension is there in the future as well. People don't necessarily need, if they have the public interests well served through public health care, education, and infrastructure, then it's not as though we need a huge pension each because we have our collective wealth that we share together.
The only thing that I would add is that well, stress, I should say, because David mentioned, he talked about how people just like you here in this room started writing into your MLAs. And really, that's the way we're going to change this society. It's not a magic bullet or a magic pill or whatever the case may be. Yes, we're leaders within the Alberta NDP, but we can't do it without you. That's the reality. And that's why it's so important to build this party that represents a true alternative. And that we represent that inside the legislature as well as outside. Because it's the power of people coming together and demanding a specific standard in terms of life here in the province of Alberta that's going to get us there. We need you just as much as you need us in order to make sure that appropriate legislation is made through that house.
Yeah, I would just say, and in terms of where the NDP would go with that issue, I mean, there's two pieces to this. There's seniors now, and the income security experienced by people who've already retired. And then there's the issue of how we plan for the seniors who are coming, who've not yet retired. Because I think probably everyone here knows the next 20 years, the seniors population is going to double. And every time you listen to CBC in the morning, they talk about how nobody who's coming up to retirement has saved. And over and over the next 10 or 15 years, more and more people are going to be retiring or not retiring, as the case may be, because they have no money to retire on. So we need to do an overhaul of our pension system in Canada. I mean, we are an extremely wealthy, developed country, and there is no reason for us not to have a comprehensive pension plan that reaches out and supports Canadians on a universal basis. And that's something that the Canadian Labour Movement and the federal NDP has been pushing quite aggressively, and I support it completely. And frankly, every province in the country supported it, except for the Brain Trust here in Alberta, who did everything they could to shut down that discussion. So an NDP government would reverse that position in Alberta, and we would pursue a national discussion about updating our pension plans. For those already retired, we need to look at issues around indexation, and we need to look at issues around what people are being asked to pay for now. More and more people are being asked to pay for, and we need to look at reversing that where we can.
I just have a very quick and simple question. Seniors are always getting accused of utilizing our healthcare system more than any other groups I've met. It's not necessarily true. There's a Stats Canada report that came out today in terms of home care that certainly indicated that it wasn't seniors who are using more home care. But my question is about governance of healthcare in our province. And I know that the NDP has called for the abolition of Alberta Health Services, and I don't think people in this province have lost trust in their public healthcare system. They've lost trust in the governance of their healthcare system. So how would you see the governance of Alberta Health Services if we do get rid of the Alberta Health Services Super Board?
You don't mind, I'll go first this time. I would say that there's something absolutely essential that we need to look at, and that's there's arguments for decentralization and centralizing of the governing of Alberta Health. So moving into this, we need to discern what are the pros and cons of each, of a decentralized system and a centralized one, and be able to look at what are the benefits that we can gain from both of them to come up with a new system. But absolutely essential to that system is the fact that people who live in the specific regions can then put feedback and let the government know how they want their services to be provided, right? All of the essentials, because they're the ones that are, and not only the people who are receiving, but as I stressed before, those who are providing it too. Through a collaborative, cooperative approach, bringing people to the table within those specific regions to address their needs, that's the way we're going to be able to have a governing system that we can make sure is meeting the needs of those people. And I think that's what's been lacking, or even like the government's consultation processes that they say they implement are really not consultation processes. They're just, there's something that's already, it's like, okay, we just want you to rubber stamp it, right? So I think it's going to take an investment of time and energy to get us there.
Well, it's a really interesting question, Sandra, because certainly our position thus far, particularly in reaction to the abuses at the AHS level, has been to say, listen, let's just get rid of this board and let's bring it under the minister. And part of the reason that we've done that is because we want to see accountability increased. We want to see when that $16 billion transfer to AHS is published every year in the budget, we want more than a one-page freaking document that tells us how that $16 billion is being spent. And that's all we've got right now. And AHS had evolved into this monolith, not only of gross, personal expense scandals, but also a monolith in terms of its lack of responsiveness to Albertans, to citizens, to the voters, to communities. And so we need to restructure the system so that responsiveness is built back in, so that the transparency and accountability is built back in. But ultimately, the other thing that really matters a great deal to me, as someone who's worked with and in and around the system, is stability. Because I honestly think at this point, the biggest casualty of the PC inanity over the last 6 years has been the incredible damage to the morale of everybody involved in healthcare services provision through the constant restructuring. And so we need to land on a model, listen openly in an open setting to all the arguments for the different models, figure out how to meet those objectives, plan something, and then stick with it long enough for it to start working.
Alberta Health Services as an entity was created in 2008 to act as a smokescreen or a buffer to the privatization agenda that the PC government was going to implement after their massive majority, one of the 10 or 12 massive majorities they've had. Over time, it has eroded and created this Byzantine, confused governance structure that doesn't follow best practices, that's incredibly top-heavy and inefficient as well. And so when I talk about the abolition of the Alberta Health Services, I'm talking about the highest level of management that has caused the greatest degree of harm, not just to healthcare delivery, but to the integrity and the sense of trust that we have to look to our public health service to be there for when we need it for ourselves and for our family. It's interesting that Jim Prentice, during this leadership campaign, said that, oh, well, moving the abolition of Alberta Health Services, I think I made him talk about it actually, I felt pretty good about it, he said, oh, well, then you'll have the ministry and the minister in charge of $16 billion. That's too much responsibility for one person. Well, excuse me, Jim Prentice, you're the premier, going to be the premier now. You are responsible for that $16 billion. The buck stops there, right? And so it's very important for us to take a couple steps back. Rachel's very correct that we don't want to just turn everything upside down again. But at that very highest level, it's time for AHS to go and responsibility go back to the people who actually deliver public health care.
I'm very glad you have come here and listen to all of you. As someone who is very lucky in life, in that I'm seldom sick, so I don't have to access a lot of health facilities that you have here. What I would like to ask you, or at least that you give me some views of, how do you intend to raise the quality of life of all seniors? If you do that, I think it would also help all everyone who lives in Edmonton, at least, or in Alberta. So, one area, perhaps it would be good to say, which you have all touched on very likely, is the responsibility of each and everyone living here. Another area would be, how do you propose to inform people in such ways that they are empowered Well, that's a big word, isn't it? But they are empowered to act upon what can contribute to their quality of life. I think that's very important because that, I think, helps them to speak out and to access whatever there is in our constitution, in the various levels of government, so that we have more time for one another, and that we can improve and be more communicative.
Well, that's a big question, because it really because seniors as a whole are not the same people, and the situation that seniors find themselves in are not the same. So sometimes you can talk about quality of life in terms of how it's absolutely not appropriate for a senior who needs medical care to be sitting in a hospital bed for 6 months rather than in a long-term care center where they're better equipped to deal with quality of life issues, because that poor senior that's in the hospital bed for 6 months there's no provision for quality of life programs or supports or anything versus the long-term care, for instance. So that's one example. The other example, though, can be a senior like yourself who's in the community living their life to the fullest. And then what we're talking about, there are different issues. So like, for instance, Robin and I have been involved in ongoing fights about funding for a community-based seniors group. And so and what kind of activities that community-based seniors group can afford to provide to its members, so the quality of life has grown. So there you're looking at things like FCSS funding, right? That's community, urban, or municipally delivered provincial funds that work directly with the community in a more consultative way to create programs and activities and opportunities for people in the communities, some of whom are seniors, and it builds community, and so it's great. So maybe, and FCSS happens to not increase funding since 2008. So there's a whole bunch of different levels in which we can address it.
I would complement that by saying that it's really about a community-based, intergenerational approach. I think that sometimes I identify myself as an outsider because I came as a refugee to Canada. But when I look at other jurisdictions in the world, I see seniors and young people all working together. And I don't see as much of that here. I see it sometimes, but I don't see it as much. So in terms of the program, for example, intergenerational theater program, where people are getting together not only to do theater, but to discuss the ideas of the issues relating to their lives. I think that we need to get more creative. We need to start thinking about how we're all connected with one another, right? So it's not just the seniors issue. It's about our whole community and how we're all interacting with one another. And the fact that currently everything is so based on a financial view or based on the individual, that's what has us going into this area where we're all disconnected from one another. When we start looking at the human person, the dignity of the human person, and who we are collectively as a community working together to address our issues, it stops being a seniors issue or a youth issue, it's everybody's issue.
Thanks, Rod. And I thought of the phrase that money can buy you happiness, but certainly a certain level of income can buy you the satisfaction to be potentially more happy and certainly more secure. And we know that when we retire, we have a fundamental drop in income, and we have an unacceptable number of seniors that are living in poverty here in the province of Alberta, exacerbated by the immense wealth that we see gliding by us every day. And so by making certain choices, certain legislative choices to make life more affordable for seniors, I think that we can increase the quality of life, or at least potentially There's the things investing in, like I said before, in the things that we own together to have a stronger public health care system that's available to us. If a doctor prescribes you physiotherapy or some different kinds of occupational therapy or medical devices that you require for your health, then we should pay that together through a public health system. I mean, that's why we designed a public health delivery system in the first place. Somehow someone stole physio, for example, away from us, and it needs to go back into public health care. Dentistry as well, optical care. These are not, they're not options. I mean, I'm not talking about getting gold caps for your teeth, but I mean, for basic dentistry and optician, again, these are medically necessary things that should be publicly paid for.
Hello. One comment, two questions. Comment is, I don't think it matters which one of you win. I think the party would be in good hands, no matter who wins. First question, and it's because I have a preference for government and the private sector to cooperate and help build the economy. There's a track record of mega projects and small projects where government and private sector actually do work well together. Regarding healthcare, like this is a question, it isn't like a statement. Regarding healthcare, when you everything is run by the government and the private sector isn't there, I think you're going to shoot yourselves in the foot. And all you need to do is be good managers. You get good regulations, good rules, and you hire the people to enforce them. If the private sector doesn't do their job, like anybody else, they're out the door. So, and I've seen some real success stories with government and private sector partnering up on what the common ask. The other one is this. What Ottawa does with our transfer payments, they come back to Alberta, and for example, they say, look, we would really like two-tiered medicine, one for the rich, one for the poor, like the U.S. has. So what they do is they cut back in the transfer payments. So as Albertans, we go to the hospital, we're in a lineup, there's hallway medicine, and we say, this medical system isn't working. Well, it's not working because Ottawa has cut back in the funds. So how do you approach that? Because you can bet that that's going to happen. I mean, that's what the current government of Ottawa wants, and that's their modus operandi, how they're going to do it. So what kind of pushback do you get? Would you be bold enough to do what Danny Williams did in Newfoundland and lower the Canadian flag to half-mast? I thought it was remarkable, and I saluted him for doing that. And Danny Williams won the day. So we need a leadership that's going to stand up to this group in Ottawa. That's my question.
Sure. Yeah, absolutely. As a public health advocate and now as the health critic, I understand the fundamental landscape here in the province and right across the country. And that is, there's always a tension between public and private health care. It exists, and I believe realistically that it will continue to exist far, far into the future. And so I have a responsibility and a role to advocate for that part of the healthcare system that is public and is publicly delivered as well. And so that really is my reason for being here, quite frankly, as a leadership candidate, as a member of the legislature for the Alberta New Democrats, is to push back against that privatization that is taking place right across the country and right here in our backyard too. So I don't preclude the possibility of innovation and interesting and well-intentioned healthcare providers that are nonprofit or private, but at the very least, my job is to push back on that. And if that does produce something as a result of that fundamental tension, well then so be it. But that's what I do. I'm a public delivery healthcare advocate, and I will be as long as I'm around. And so that's fine. The other question, very quickly, I know I'm going to lose the time, but it's very important for us to be leaders here in the province so that the rest of the country could follow. The feds only put 20% into our public health care system now. They have no right to dictate the terms by which we operate that. And of course, you know how I would operate it. Thank you.
I'll be honest, I concur with David. I'd be fighting right alongside him in terms of public health care. I don't think we differ on that at all. As I suggested in earlier comments, I'm really concerned about for-profit healthcare and the whole concept of profiting off of elder care or healthcare in general. For me, it's an ethical thing. I think that the innovation comes out of the needs. So if we have community members coming to us and telling us, look, these are the needs I have, we'll address them. We have professionals within healthcare that can make sure that we're staying with the times, whether they be technological or in how the service is provided. But we need to make sure that healthcare stays publicly funded and publicly delivered. And in me, you have an advocate, strong fighter for many causes, and this is definitely one of them that's a high priority for me.
Yes, I think you're going to find consensus up here in terms of all three of us perhaps taking some issue with the premise of your first question. And just to sort of unpack that a little bit more, I mean, I definitely am an advocate for publicly funded healthcare and publicly delivered as much as possible. And the reason for that is because the research bears out the efficacy and the efficiency of that. There's a great paper that came out just a few months ago that showed the difference in the level of care in privately operated long-term care versus publicly operated long-term care. In the publicly operated long-term care, there was just more hours of care. That's all there was to it. There's loads of research out there about the comparative quality of care between public and private. The other thing that happens in our healthcare system is those areas that continue to be privately delivered, even if publicly funded, are rolling out of control. The two biggest cost areas, pharmaceuticals, no connection to what it actually costs to produce those pharmaceuticals. And the other one is high tech. The high-tech industry is driving our healthcare industry costs much farther up than they need to be, again, because it's a for-profit delivery system. So I don't agree that we need to necessarily pull those two together as a principle. Perhaps occasionally, because that's where we are, we have to work with it. But as a principle, I'm not going to pursue it, quite the opposite. In terms of the other issue, and the Danny Williams thing, I just want to say this. I agree with David that provincially we have the ability to provide the health care that we need. But I will say this about Danny Williams, is he stood up to the oil companies to get a proper 5% equity interest in the oil and gas development. And we could use a bit of that here in Alberta, so thank you for bringing him up, because we need more of that kind of political leadership when it comes to our relationship with oil and gas companies. Thank you.
I belong to the French Sept community, and a few years ago we built a manoir, well, we helped build a manoir settlement so that seniors could age in place, either if they came from the farm or French communities with their children in Edmonton, or within the community where they had lived. In January, many of the workers in the institution were told, unionized workers, were told that their jobs were over in May, that the Alberta healthcare was not paying enough to be able to hire unionized workers. It's a big problem because everybody that works there needs to be bilingual. You know, you never know when there'll be an emergency and somebody has to understand. The demographic of French population, maybe unilingual, is not going to change because right now we have many, many people coming from Africa, all entire families. And so some of them will be seniors very soon, and they will not have time to learn very much English before they age. Thank you.
Well, I think you highlight 2 points there that are worthy of consideration. First of all, AHS has to fund the providers of either, whether it be continuing care, as is the case at Manoir Saint-Thomas, I think, or whether it be in long-term care, they need to fund the providers adequately so that they can pay their staff adequately. It's that simple. That's all there is to it. I deplore situations where staff and residents are pitched against one another, primarily because our government chooses not to fund them appropriately, and that needs to stop. So that's my first point. My second point is I absolutely am aware of the amount of work that went into providing language-sensitive services there, and that needs to be respected. But I think we also, we also need to expand that kind of consideration, because the fact of the matter is we are becoming an increasingly diverse province, and there is a huge gap in terms of the provision of seniors care for new Canadians in Alberta. Edmonton is one of the most multicultural cities in the country now. People don't realize that. And English is not a language comfortably used by a growing number of seniors in our province. And so we need to understand that to deal with that quality of life issue and that dignity issue, that we ensure that the services that we provide accommodate and take into account the challenges that some of these seniors face. Even if it's something like, providing more English language learning opportunities for them in those settings. But we need to really address it, because it's a growing issue in Edmonton.
Thanks, Rachel. Yes, it's a very unfortunate situation at Sept, I was involved from early this spring, and basically what I could discern, and this is a perfect example, a lesson of how we need to change the way we fund seniors care and assisted living care in general. The provincial government just was giving block funding without accountability and without any provision for a certain regulation rate of pay and benefits and care as well. The government, what we do in the legislature fundamentally is that we provide a set of rules for people to follow, so that you have something that's reasonable, that's something that's just, and something you can count on in the future. All three of those things have been compromised by this PC government's failure to create a set of rules of how funding should go, how that money should be applied, a standard of pay for care workers, and a standard of care for individuals in each of these facilities. Certainly, our first job to do, not just as pass this leadership, but forming a new Democrat government in this province, is to provide that sort of leadership so that something like St. Thomas doesn't happen again and again and again and again. I've seen at least 7 examples since 2008, when Alberta Health Services took over, of the very similar circumstance. People pitting the patients and the workers against each other. It's just, it's unacceptable.
I think that Rachel and David have said it all, and I'll just go back to the fact that that's a financial view of how you build or build a seniors program or senior programs, right? And that's what we have to do. Like I said before, we got to turn this thing upside down, because as long as that is how you conceive of programming, whether it be for seniors or youth or whoever, education, whatever the case may be, we're always going to be dealing with these issues with, how do you deal with your bottom line, right? And it doesn't matter whether it's a for-profit or a not-for-profit, as I stated before, they're starting to act more like for-profit, because they're looking at that bottom line. And then not only that, instead of, how David's saying, providing a set of rules, they're actually suggesting, Alberta Health Services is actually suggesting that they bring in temporary foreign workers so that they can lower the wages of these support staff. So as long as that's the case, we're going to be dealing with the same thing. So, ladies and gentlemen, we need to change that. Yeah, we got to change the government. We got to do it all together.
Just 2 quick questions for you.
The issue Rod brought up earlier, working at the University of Alberta and being part of public service, touched a serious point in my understanding of how things work. You indicated that you had this lady there with 2 kids, and she was not only having to pay, she had to pay for her drugs, but your plan took care of your drugs. Well, I need to remind public service that not only was she paying for her drugs, but she was paying for your drugs through her tax system. So all of public service needs a bit of humility to say, thank you. Because we have a fantastic public service in this province. They do great work. I'm talking about politics, the police, the hospitals, the education, all of it. But they really need to recognize that it's the taxpayer at the very lowest level and the seniors who are retired whose tax money is actually paying for not only their salaries, but for their benefits, their pensions, and everything else. Income security is very critical for seniors today, and reiterating what was said earlier, there needs to be a better way of looking at this, and one of the thoughts that I was having is one of the biggest pools that is unrecognized in this province is volunteer labor. Seniors are incredible volunteers. They have great talents and gifts to be able to bring to the table. There needs to be some way of perhaps helping those that need it and want it to get a tax credit or some sort of feedback for volunteer labor that they're doing, so that they can in fact be encouraged to make contributions to the society as they continue to age, not just to be, as society likes to paint them, as the recipients of what's going on, but they're still contributing. So if you can find some way to honor their efforts as volunteers, that would be incredibly appreciated, and it would help perhaps on the financial side, lowering their tax burden to people of that nature. Anyway, those are 2 thoughts from me.
Sure. Sort of question? I mean, oh, thanks. Taking the tough questions here. Again, it's just a perfect example of how when you take an essential part of healthcare and you remove it from the single-payer system. I mean, I always try to remind people, of course, we're paying for all of our healthcare. We're just paying for it in the most efficient way by using a single-payer insurance system. So we're all in there together. Once that particular form of care, in this case pharmacy, is removed from that, then it's fractured 6 ways to Sunday. You know, people have some fantastic Blue Cross system, payment insurance, and some people have nothing at all. And so, you know, again, by bringing that all together, it's not just he pays, she pays, they don't pay, and all this, but we all pay it together. We realize the efficiencies from an economy of scale, and we probably end up with a healthier society as well. Again, just further with the pension, talking about the pensions as a cathartic experience for me, we know that we can pay for these pensions if you amortize and if you look at the long game, the big picture, right? So often people are pulling away, saying, oh my goodness, we had 2 years of bad years, we have to pull the bottom out of these pensions. I mean, what utter nonsense. A pension is an intergenerational investment that you look over a 60 or an 80-year period or more, not just when you have a couple of bad years and it gives some right-wing ideologues an opportunity to try to grab that pension and remove the security that everyone deserves here in the province of Alberta.
I'm not entirely sure that I have a lot to add at this point. I've talked before about the fact we haven't had a lot of chance yet to talk about community-based services and opportunities for seniors. We've mostly talked about healthcare, but there's no question, there's a whole area that remains untouched, primarily through the failure of this PC government to look at the issue of community development opportunities, primarily through our municipal levels of government, but also directly with community groups to promote and support that level of volunteerism. Am I suggesting right now that we're going to bust out with a bunch of tax credits? Probably not yet. That's not a policy I've put a lot of thought into. But definitely supporting those kinds of programs that provide a venue for seniors to be engaged in volunteer activity and to be more active in their communities. We had a much higher level of that in years past, and those were some of the first areas that were cut when the government decided to sort of go into Ralph Klein 2.0 in the last 5 or 6 years and start cutting things. And so I do think that we need to look at those. And as I said before, I'm not sure how many people here know what I'm referring to when I talk about FCSS, but it's probably the single biggest community development line item of funding that the provincial government has. It has been frozen since 2008, which means slowly these volunteer programs are starting to wither on the vine because they can't keep up, because it's not keeping pace with inflation. And that's something that's really fundamental to ensuring the quality of life in Alberta grows at the same pace, and heaven forbid, even at a better pace than our economic development. So I want to make sure that we make quality of life and community development an ongoing priority in our province.
I've been living in Edmonton since 1961. So I've seen healthcare being cut, I've seen long-term care suffering, I've seen mental institutions being cut, all as a result of the cut in the price of oil, or to the price of natural gas. So when natural gas and oil are high in price, we live high on the hog, we get everything, and as soon as the prices drop, everything goes to pot. What would the NDP do instead?
I think that we have a marvelous example in Norway. We're talking, and yes, it's a country as opposed to a province, but we're talking about a jurisdiction out there that has been able to capitalize on the fact that they've been able to have corporations come into the country, but at the same time, they've nationalized some of the oil production, and they've done it in a number of ways. Number one, they've actually made partnerships with corporations that are coming in. And one thing that I want to stress is that in Norway, they get 90% royalties. And the corporations still come in because it's still profitable for them to go in there and extract those natural resources. That to say that Alberta, we're giving it away, you know? A lot of you know me from the development sector. I used to be in development and do work abroad. And I remember learning about a country in Africa where they were mining diamonds. And the corporations were taking out 90% and leaving only 10. And it was such a huge issue for the people in the development community. And I'm telling them that same thing is happening right here in Alberta. We should be just as disgusted, because really what we're talking about is exploitation. Okay? Thank you very much. I didn't get to all my points, but they're good. Yeah. Perhaps David could elaborate more.
Yeah, no, that's very, very appropriate, Ron. And what we need to do immediately, again, it's like I said before, we create the rules in the legislature. We can set that royalty rate so that, at the very least, it's in keeping with what's charged in other jurisdictions around the world. Right now, it's at a bargain basement rate. It's only at a fraction of what the PCs 30 years ago were managing to get, and this just simply has to change. Every month that we lose millions of dollars, we just don't get it back. And that's money that we can be using to pay for our essential social services, but also to transition into a more renewable energy economy that is diversified and that takes us out of the vagaries of the boom and bust cycle that we've had to live with here in the province of Alberta for the last 40 years or more. I've lived here just as long as you have, and it's a roller coaster, right? And even when you're on the boom side, life becomes very expensive for average people. And when you're on the bus side, you don't have a job, and everything just follows from that. it's important that we set up a structure as well to diversify and to upgrade the energy that we do have here in the province of Alberta. You don't just sell raw materials to another country and let them get the value-added price for it. You upgrade to synthetic crude. You can sell that to the world and have all of the ancillary industries that come with that, as well as well-paying jobs that stay here in Edmonton, and people don't have to go to work camps in Fort McMurray necessarily. It's a way by which we can not just get money, but to have a say in the control of our own future, to say that we will not mine it all at once in one generation, but rather we will mine it according to our capacity to upgrade that product, and so that we leave some of that wealth and choices for future generations.
So I agree with everything that these guys have said. No big surprise. Just in terms of how it is that we can pitch this more effectively to Albertans or get it back on the agenda. You know, as many of you probably know, my dad spent a good time of his career actually opposing and contesting the values of Premier Lougheed. And so it's interesting that now I'm at the point of actually pulling out Peter Lougheed as my guide and my mentor. So I apologize. But that being said, the fact of the matter is there's a lot to be gained from what Peter Lougheed ran on. When he ran in 1971, he said, listen, Socreds, you tired old guys, you're only getting 15 cents on the dollar right now. That's highway robbery. Albertans deserve between 35 and 40 cents on the dollar. And that's what he implemented for a period of time. But the fact of the matter is that now we're about 8 or 9 cents on the dollar. So if it was highway robbery when the Socreds did it in the early 70s, it's highway robbery now. And we need to change that. We need to get our fair share, and then we need to make sure that a lot of that comes into creating a fund that evens out those ups and downs that you're talking about. So we're not spending it the second we get it. We're investing into long-term fiscal stability, and we're investing into a more stable, diversified economy. That's the model we should be doing. I worry about how much we're letting slip through our fingers and how much we've let slip through our fingers in the last 40 years. And I don't know how much time we have left, but we had better make the most of it, and we better get a government that's committed to doing that.
I think we need to become better learners as a society, and one of the ways to do that is to go back to a system that we used to have of designated community schools in the province, which became community learning and participation centers, so that the school becomes a focal point for community development and community learning for people of all ages. And it's quite doable, and I don't see why we don't do it. We don't, and I don't think we will.
Yeah, I would agree wholeheartedly with that statement. I think that across the province we need to focus on making schools communities of learning that complement the academic, the cultural, and the economic growth of all of the communities across Alberta, right? We have to start looking at have a holistic vision for how we're educating youth in this province and how they're going to be able to contribute to the society as we move forward, right? So I agree with you wholeheartedly, and I think that that's going to take an Alberta NDP government to do it.
It's interesting, in my own constituency in Edmonton Calder, two very interesting examples I would like to bring forward. Number one, they tried to close a school back in 2005 when I was the MLA, saying that low enrollments and the future of that school just made it untenable. Now in 2014, the school is full, and it's created a whole new epicenter for renewal in that Wellington neighborhood. If the school was gone, people wouldn't be buying those houses now and creating that second or third generation in Wellington and revitalizing the neighborhood. I was just door knocking up there about 45 days ago, and boom, all of these young new families there, and all their kids are going to MacArthur School. Part two of the story is up in a new area where they're building houses up towards the Henday, And there's only one school there. There's no community center at all. The school is bursting at the seams. They should have built not just 2 schools, but probably 4 schools, and a community hall to bring the whole community together somehow. I mean, it's just such an obvious state of confusion and an illustration of that you can't believe the hype with this PC government talking about closing the inner city schools in order to build the suburban schools, because they're trying to close this inner city schools, and they're certainly not building the suburban schools either. So it's time for an NDP government, right, Ross? Absolutely.
Well, I disagree about the NDP government. Anyway, no, well, of course, as many people may or may not know, Brian was actually the author of some incredibly innovative work around community schools many years ago, which drove some positive change a couple of decades ago, I think it was, but of course much of that has been abandoned. And a lot of that comes from the fact that governments are in a very defensive, shrinking mode, and one of the outcomes of that is they become very siloed, and so the municipality says it can't possibly be involved in decision-making that would impact the schools, and the schools, and the province says, oh, it's really up to the school boards, and the school boards say, well, we have no control because we have no money. And so we've been talking now for 3 or 4 years about the need to, I think at this point, legislatively bring all 3 levels of government together on this issue of school development, school placement, and school construction, so that it reflects community needs and it also enables the kind of more expansive role for schools in our communities that Brian's work first started talking about. It has to happen. The only government that has the authority to compel that right now is the provincial government. And our provincial government has done nothing but give lip service to this and bust out with the occasional talking point while crying crocodile tears as our schooling infrastructure deteriorates in both growing communities and communities at risk. It's bad planning, it's complete negligence, and it's a rejection of good public sector, public interest governance. That needs to change, and that's why we need an NDP government.
If you asked me before this meeting started what were the chances of Carol sitting and saying nothing at all for the whole meeting, I'd have said 0.
I won't say what I'm thinking. We all know that one of the real risks to both health and quality of life for seniors is isolation. When you don't have contact with a community, let alone with your peers, but with other groups in the community as well, and you don't have a chance to think and talk about issues with them and learn what their lives are like and tell people what your life is like. And that communication is probably one of the essential components of being a healthy human at any age. Now, back in the 90s, we used to have community groups that got funding from the provincial government, who gave people the opportunity to do that. And my mother, when she was forced to retire at 65, which she considered a huge insult, got very active in a group called, what was it called? Society for Retired and Semi-Retired, which became SAFE later. Now, that wasn't just a name change. That was a result of the provincial government withdrawing the funding for that community group to meet, to interact with the community, to talk about ideas, to do research, to identify problems and propose solutions. That funding got changed, and now this agency, as valuable as it is in this community, is a service provider. Basically a service provider. And that's been another shift that's been happening. Now, it isn't just happening to seniors, it's been happening throughout the community. And the damage that it's done to our supposedly democratic system of governance in this province is huge. And I'd like to know if you have suggestions about how a government could reverse this change and allow us not to become isolated, because more and more of us are understanding that the problems we face in our lives are political.
I I would state that the fact that this PC government over the 43 years has cut funding to programs like that shows that they're representing not our interests, but elite interests. They're not interested in researching and analyzing on how to fix the problems, right? And the only way that we're going to get there, as I've already stated, is that we need to have, it's the synergy that's built by everybody who's affected by the problem. I'm a person that believes in the principle of subsidiarity, which basically means that the people who are closest to the problem should be the ones that are finding the solution. And that's the kind of, and the PC government isn't allowing for that right now. So more and more consistently, you're going to have more seniors, but you rightly said it, Carol. More individuals from society falling into that isolation. They're disconnecting us from one another, as I alluded to before. So if we want to change this, we need a government that's going to go back to a collaborative, cooperative way of working together to find the solutions to the problems that we're experiencing in a home, right? We need to be able to do that. That's community, as you rightly said. The majority of the problems that people are facing are political. The only way we're going to get to solve them is by working together.
I agree very much with what Rod said, and I've already touched on this issue to some extent in terms of the need to refocus how government interacts with community and promotes healthy communities. And it's interesting, you know, because here we are in Alberta, and for so many years, all these kinds of agencies that, whether they're service providers or whether they're more community-based sort of forums for people to just connect, have been historically so darn scared to talk about politics for fear of losing their funding. And then on top of it, they do lose their funding. And then they're still scared to talk about politics. And at a certain point, it's like, when exactly are we going to start talking about politics? Like, there's going to be no money left at all before we open our minds or open our mouths. And you know, you look at what's happened in Alberta, where people are so incredibly, there's a built-in structural fear of speaking out against the government. And you may not even be aware of it, but when I moved here from having lived in 2 separate provinces for a period of time, it really, every time I come back to Alberta, I'm quite taken aback by the hesitation and the fear and the caution in terms of advocacy in Alberta. So we need to switch that. And I see what's happening now in Ottawa, where the Harper government is now trying to go after the CCPA and the David Suzuki Foundation and all these organizations, which frankly, whether you're left or right or brown or blue, what they are is natural manifestations of community engagement and community, people caring about their community. I don't care if you agree with them. They're there because they care. And so, but yet the government is now deciding whose opinions they want to fund and whose opinions they don't. And I swear to God, it's a replication of what's been going on in this province for the last 25 or 30 years. Harper doesn't even see what he's doing is wrong because we've been allowing it to go on for so long here. So my advice to you is say, enough already. Got nothing to lose. It's time to start speaking out, get political, and call out the government on the many issues on which they deserve some calling. Thanks.
Well, I'm very concerned about, in the absence of policy and planning, that Alberta is more and more becoming a place where people live and work and then leave and live the rest of their life somewhere else. And we see it obviously in Fort McMurray and in other places like that where it's so expensive. But that whole phenomenon, in the absence of planning, I think is spreading over the whole province here as well. If we're building a society, a community here that includes the nurturing and the infrastructure that will look after people in all stages of their lives, that it includes the community centers and the opportunities for people to live an affordable and rich and full life in their communities as seniors. We have the Calder Seniors Drop-In Center in my area, where now it's called the Northwest Center. so we can try to get some more funding, which we're desperately short of. And it's a model that can take place very organically right across the province and in all parts of Edmonton if we provided the funding to do so. When it was built back in 1980 or so, there was adequate funding, and now there simply isn't. We're trying to expand that model into different cultural groups as well. The more we can include new Canadians into these centers and this sense of looking after each other, then the more likely we are to have those public institutions for the next generation. Thank you.
Well, I see that we've run out of time before you run out of questions, which I think is a nice way to finish.
Sure.
First of all, I would like to thank our speakers for this afternoon. What can I say? They've done us proud. Second, I'd like to point out to all of the rest of you that if you liked what you saw here and heard, then one way of getting more involved is to buy membership. And I do, there's no compulsion, but I would like to see at least 23,000 people voting for the leaders. Might say the message is a slightly different sort to the provincial government. Thank you all for coming, and